Your heart is sending you signals right now. Quiet ones, subtle ones. Signals that are easy to dismiss as just getting older, as being a little out of shape, or as something that will probably go away on its own. And if you're between 60 and 80, there's a very good chance you've felt at least one of these signals in the past few months and brushed it off. Maybe you got unusually tired climbing stairs you used to take without thinking. Maybe you woke up needing to use the bathroom 3 times last night when once used to be normal. Maybe your ankles have been swelling by the end of the day and you figured it was just from sitting too long. And here's what I need you to understand. Those aren't random annoyances. They're not just age. They're early warnings that your heart is struggling to keep up with what your body needs. And the reason this matters so much is that heart failure, the condition where your heart can't pump strongly enough to supply your organs and tissues, doesn't announce itself with a dramatic chest-clutching moment the way a heart attack does. It creeps in slowly, over months or even years, with symptoms so quiet that by the time most people realize something is seriously wrong, their heart function has already declined significantly. But here's the hope I need you to hear immediately. Caught early, heart failure is manageable. The right medications, the right lifestyle changes, and the right monitoring can stop the progression, improve your symptoms, and give you years of active, independent life. But caught late, after your heart has already weakened substantially, the options narrow and the quality of life declines steeply. So the window we're talking about today, the space between the first quiet signal and the moment it becomes obvious, that's the window that determines everything. In my years of practice, I have sat with too many people in their 70s who came in after months of ignoring signs they didn't understand. And by the time we diagnosed heart failure, they'd lost function they'll never fully get back. And almost every single one of them said the same thing. I just thought I was getting old. I didn't know this meant my heart. That lack of knowing is exactly what I'm here to fix today. Before we go any further, do me a quick favor. If you want videos that teach you to recognize what your body is actually telling you instead of just dismissing everything as age, hit subscribe, give this a like, and leave me a comment telling me your age and whether you've noticed any of the symptoms I'm about to describe. I read every one of those comments, and they tell me exactly what's not being explained clearly enough in your appointments. All right, let's get into it. But first, you need to understand what heart failure actually means, because the name is terrifying and misleading at the same time. Heart failure does not mean your heart has stopped or is about to stop. It means your heart muscle has weakened and can't pump blood as efficiently as it used to. Think of it like a water pump that's losing pressure. The pump still runs, but it's not moving as much water with each cycle, so everything downstream starts to suffer. When your heart can't pump effectively, two things happen. First, blood starts to back up in the vessels leading into the heart, like water backing up behind a weak pump. That backup pressure forces fluid out of your blood vessels and into your tissues, which is why heart failure causes swelling. And second, your organs and muscles don't get the full flow of oxygen-rich blood they need, which is why heart failure causes fatigue and shortness of breath. Everything I'm about to show you stems from one of those two mechanisms: backup or inadequate forward flow. Once you understand that, every symptom will make sense. So let me show you the 6 early warning signs, and I want you to pay very close attention because if you're experiencing even 2 or 3 of these together, that's not a coincidence. That's a pattern, and patterns demand answers. The first warning sign is shortness of breath that's worse when you lie flat. This is one of the earliest and most specific signs of heart failure, and it has a medical name, orthopnea. Here's what's happening inside you. When you're standing or sitting upright, gravity helps pull fluid down into your legs and away from your lungs. But when you lie flat, that fluid redistributes. It moves back toward your chest, and if your heart is already struggling to keep up, that extra fluid starts to leak into the tiny air sacs in your lungs. You feel like you can't get a full breath. You feel like you're drowning just lying in bed. Most people respond by propping themselves up on 2 or 3 pillows, and they sleep that way for months without realizing it's not normal. If you used to sleep flat and now you need your head elevated just to breathe comfortably at night, that's not just a preference. That's your heart telling you it can't handle the fluid load when you're lying down. And if you wake up in the middle of the night gasping for air and have to sit up or walk to a window to catch your breath, that's called paroxysmal nocturnal dyspnea, and it's an even stronger signal that your heart is failing to clear fluid from your lungs. The second warning sign is swelling in your ankles, feet, or legs that's new, persistent, or getting worse. This is called edema, and it's one of the most visible signs of heart failure. Here's why it happens. When your heart can't pump blood forward efficiently, pressure builds up in the veins, bringing blood back to your heart from your legs. That increased pressure forces fluid out of your blood vessels and into the surrounding tissue. Gravity pulls it down to your ankles and feet, especially if you've been sitting or standing for a while. At first, the swelling might be mild. You notice a little puffiness at the end of the day. Your shoes feel tighter by evening. You press your thumb into your ankle and it leaves a dent that takes a few seconds to bounce back. That's called pitting edema. As the heart failure progresses, the swelling gets worse. It moves up your calves. It's there in the morning, not just at night. And sometimes it becomes so severe that your skin feels tight and starts to weep fluid. Now, I need to be clear. Not all ankle swelling is heart failure. It can come from sitting too long, from certain medications, from vein problems, or from kidney or liver issues. But if the swelling is new, if it's on both sides, if it's accompanied by any of the other signs on this list, and especially if it's getting progressively worse, your heart needs to be evaluated. And if you press on that swelling and the dent stays for more than a few seconds, that's not normal fluid retention. That's a sign your body is holding on to far more fluid than it should, and your heart is very likely the reason. The third warning sign is waking up multiple times at night to urinate, and I mean more than you used to. This one surprises people because it seems completely unrelated to the heart, but it's deeply connected. Here's what's happening. During the day, when you're upright and active, your struggling heart can't pump efficiently, so fluid builds up in your legs and tissues. Your kidneys, not getting great flow during the day, don't make as much urine as they should. But at night, when you lie down, gravity redistributes that fluid back into your bloodstream. Suddenly your heart sees more volume, your kidneys get better blood flow, and they start working overtime to clear the excess. So you wake up 2, 3, 4 times a night needing to urinate, even though you didn't drink much before bed. If you used to wake once a night, or not at all, and now you're waking 3 or more times and producing a significant amount of urine each time, that's called nocturia, and in the context of the other symptoms we're discussing, it's a red flag for heart failure. Your body is trying to offload fluid it can't handle, and it's doing it at night because that's the only time your circulation improves enough for your kidneys to function properly. The fourth warning sign is persistent fatigue and weakness that's out of proportion to what you're doing. I'm not talking about feeling tired after a busy day. I'm talking about feeling exhausted after walking to the mailbox, feeling like you need to sit down after unloading the dishwasher, feeling too drained to do things you used to manage easily. This is one of the most commonly dismissed symptoms because everyone tells you that fatigue just comes with age. And while some decline is normal, profound fatigue is not. Here's why heart failure causes it. Your muscles and organs need oxygen to create energy, and oxygen is delivered by your blood. When your heart can't pump enough blood forward, your muscles don't get the oxygen supply they need, so they fatigue quickly. Your brain doesn't get optimal flow, so you feel mentally foggy and slow. Even simple activities require more effort because your body is working harder to do the same tasks with less fuel. And because this happens gradually, you adjust without realizing how much you've lost. You stop taking the stairs. You stop going for walks. You sit more, move less, and convince yourself it's just what happens at your age. But it's not age. It's insufficient cardiac output, and it's fixable if caught early. The fifth warning sign is a persistent cough or wheezing, especially at night or when lying down, that doesn't seem to be related to a cold or allergies. This one gets misdiagnosed constantly. People are told they have asthma or chronic bronchitis, or that it's just postnasal drip, and they're given inhalers or allergy pills that don't help, because the problem isn't in their airways, it's in their heart. Here's the mechanism. When fluid backs up into your lungs because your heart can't pump it forward, that fluid irritates the airways and triggers a cough reflex. Sometimes it's a dry, nagging cough. Sometimes you bring up a little bit of white or pink-tinged frothy sputum, which is a very specific sign of pulmonary edema, fluid in the lungs. And sometimes it's more of a wheeze, a tightness in your chest that feels like you can't fully expand your lungs. It gets worse when you lie down because that's when fluid redistributes into your chest. It improves when you sit up or stand because gravity pulls the fluid back down. If you have a cough that's been hanging on for weeks or months, that's worse at night. That doesn't respond to cough medicine, and especially if it's paired with shortness of breath or swelling. That is not a respiratory problem. That's a cardiac problem, and it needs to be evaluated as such. The sixth warning sign is sudden weight gain, and I mean rapid, unexplained weight gain over a few days or weeks, not the gradual kind that comes from eating too much. Heart failure causes your body to retain sodium and water because your kidneys aren't getting good blood flow, and they respond by holding onto fluid. That fluid has weight, 2 or 3 pounds in a few days, 5 pounds in a week, sometimes more, and that weight shows up on the scale even though you haven't changed what you're eating. If you step on the scale and you've gained 3 or more pounds in a couple of days or 5 or more pounds in a week, and there's no obvious reason like a big salty meal or a change in your diet, that's fluid retention. And fluid retention in the setting of any of the other symptoms we've discussed is heart failure until proven otherwise. Many people with known heart failure are told to weigh themselves every single day for exactly this reason, because sudden weight gain is often the first sign that their condition is worsening and their medications need adjustment before things spiral. Now let me show you how these 6 signs fit together, because heart failure rarely announces itself with just one symptom. It announces itself with a cluster. Let me paint you a picture, and if this sounds familiar, I want you to take it seriously. You're 72. Over the past few months, you've noticed you're more tired than you used to be. Climbing the stairs to the bedroom leaves you winded, so you've started resting halfway up. At night, you've been sleeping on 3 pillows instead of 1 because lying flat makes you feel like you can't breathe. You're waking up 3 or 4 times a night to urinate, which is frustrating and exhausting. Your ankles have been swelling by the end of the day, and when you press on them, the dent stays. You've also noticed a nagging cough, especially at night, that doesn't seem to go away. And when you stepped on the scale this morning, you were 4 pounds heavier than you were last week, even though you haven't been eating differently. That's not 6 separate problems. That's one problem showing up in 6 different ways. That's your heart struggling to pump, fluid backing up into your lungs and legs, your kidneys trying to compensate at night, and your body holding on to water it can't clear. And if you go to your doctor and mention each symptom separately, they might treat them separately. A diuretic for the swelling, a cough suppressant for the cough, a suggestion to drink less water before bed for the nighttime urination. But if you present the whole picture, if you say these 6 things are all happening together, a good doctor will immediately think heart failure and order the right tests. The test that diagnoses heart failure is not complicated. It starts with a simple blood test called BNP or NT-proBNP, which measures a hormone your heart releases when it's under strain. If that's elevated, the next step is an echocardiogram, an ultrasound of your heart that shows how well it's pumping. That test will tell your doctor whether your heart muscle is weak, whether your valves are leaking, and what your ejection fraction is, which is the percentage of blood your heart pumps out with each beat. A normal ejection fraction is 55 to 70%. If yours is below 40, that's reduced ejection fraction heart failure, and it needs treatment. Let me tell you about a patient I'll call George, because his story is the one I wish everyone could hear before it's too late. George was 76 when his daughter brought him to see me. She'd noticed he was slowing down, staying home more, and sleeping in his recliner instead of his bed. When I asked him directly, he admitted he'd been short of breath for months, especially lying flat. His ankles were swollen every evening. He was up 4 times a night to urinate. He'd gained 7 pounds in 2 weeks, and he had a dry cough that was driving him crazy, especially at night. His previous doctor had given him a water pill for the swelling and told him the cough was probably allergies. But nobody had put the whole picture together. I ordered a BNP. It was over 800, when normal is under 100. I ordered an echocardiogram. His ejection fraction was 32%. His heart was pumping less than half as much blood as it should with every beat. He had heart failure, and he'd been living with it, undiagnosed, for at least a year. We started him on the right medications: an ACE inhibitor to reduce the strain on his heart, a beta blocker to slow his heart rate and let it pump more efficiently, a diuretic to clear the fluid, and we adjusted his diet to reduce sodium. Within 2 weeks, he'd lost 9 pounds of pure fluid. Within a month, he was sleeping flat again. Within 3 months, his energy was back, his cough was gone, and he was walking a mile most days. His ejection fraction on the repeat echo had improved to 40%. Not perfect, but functional. Not cured, but managed. He lived 5 more good years, active years. Years where he traveled, spent time with his grandchildren, and felt like himself. He got those years because his daughter recognized the pattern and pushed for answers. If he'd waited another year, if the damage had progressed further, those years might not have been possible. So here's what I need you to do, and I need you to do it this week, not next month. First, if you're experiencing 2 or more of the 6 signs I described, shortness of breath lying flat, ankle swelling, frequent nighttime urination, unusual fatigue, persistent cough, or sudden weight gain, call your doctor and specifically say, "I'm concerned about heart failure, and I'd like to be evaluated." Don't downplay it. Don't wait to see if it gets better. Use those exact words. Second, ask for a BNP or NT-Pro BNP blood test and an echocardiogram. Those 2 tests will tell you whether your heart is struggling. They're simple, they're non-informative, and they give clear answers. Third, start weighing yourself every morning at the same time before breakfast after you use the bathroom in similar clothing. Write the number down. If you gain 3 pounds in 2 days or 5 pounds in a week, call your doctor immediately. That's not normal, that's fluid, and it needs attention. Fourth, keep a symptom diary. Write down when you feel short of breath, when your ankles swell, how many times you wake up at night, how far you can walk before you need to rest. Patterns matter, and having that information written down helps your doctor see what's really happening instead of relying on your memory in a 15-minute visit. And fifth, if you're diagnosed with heart failure, take it seriously, but don't despair. Heart failure is manageable. The medications work. The lifestyle changes matter. And caught early, you can live well for many years. But you have to be honest with your doctors, compliant with your treatment, and vigilant about watching for changes. Your heart is talking to you. Right now. The question is whether you're listening. And now that you know what the signals mean, you have no excuse not to act. Everything we talked about today is about recognizing when your heart is struggling. But there's one simple mineral deficiency that directly weakens your heart muscle and makes heart failure worse, and almost no one checks for it. I made a video explaining exactly what that mineral is, how it affects your heart, and how to replace it safely. I'll put it right here on the screen. Go watch that next, and I'll see you there. This is Dr. Robert Chen, looking out for you.